Welcome to One on One. I'm Cyril Stover. Now, health is a key area of the administration's reform agenda, in which it commits to revamping the healthcare system, which it says will be defined by the concept of universal health coverage. Now, under this, the administration hopes to improve the quality of health services and improve the health status of Nigerians. 2 years on, how has this impacted the citizens and improved their well-being? That's the focus as I sit with one who played a role in the process from inception. Salma Ibrahim Anas is a global public health expert, a fellow of the National Postgraduate Medical College and member of the West African College of Physicians. She has a vast experience in the delivery of quality health and health systems, both locally and internationally. A former commissioner for health in Borno State, she chaired the Presidential Advisory Subcommittee on Health that developed the policy direction of the Tinubu Renewed Hope Health Agenda. Currently, she is the Special Advisor to the President on Health. Let's welcome Dr. Salma Ibrahim Anas. Thanks for joining us.
Thank you so much. Thank you. And good evening, Nigerians.
Right.
Thank you.
Okay. Health and well-being of Nigerians, and the administration on coming to office committed itself to improving the health status of Nigerians. And there was a document which it worked on, and it's been implemented. But let's start from the very beginning. You were there right from start and helped to develop this. Tell us about it.
Thank you so much. So yes, I was there pre-election. So let me start from the beginning. So pre-election, we came together with some few concerned Nigerians within the health sector. So actually, we initiated the idea, myself and Dr. Jide Idris, who also was once upon a time Commissioner of Health in Lagos State. And we felt that we should do things differently to deliver, because we seem to be stagnated in one place. So why don't we start engaging with stakeholders pre-election and help the prospective candidates for the presidential election with an agenda that as soon as they come on board, they will do that. So as of that time, we did it to cover all those that were aspiring. So we confronted His Excellency President Bola Ahmed Tinubu with an agenda, after doing all the engagement based on what are the needs of Nigerians and how do we respond to the health sector response needs of Nigerians to be able to deliver as of that time.
Yeah, he was still a candidate.
He was still a candidate. Yeah, right. And we did a lot of engagement across the country. In the northern part, we did in Kano, we did in Abuja, we did in Lagos, we also did in Port Harcourt and Enugu. So we had diverse engagement with the religious leaders, community leaders, civil society organizations, those in government, and also development partners. And we came up with the 8 pillars, what we call the 8 pillars. And those 8 pillars were based on the challenges that has affected, Nigeria from moving forward in terms of delivery of quality healthcare and also achieving the universal healthcare coverage. So as of that time, we came up with 4 pillars. The first was around the governance issues. There is so much corruption within the health systems. Fragmentation, delivery of services, and then the institutional arrangement, something was definitely wrong with it. Then we looked at another section, which is about financing healthcare. Nigeria has never had adequate financing for healthcare. We never met the Abuja declaration of 15% of the federal budgetary allocation. And the second aspect was around issues of human resources for health, that is the workforce. Then the fourth was delivery of a comprehensive, integrated, quality healthcare to all Nigerians. That has always been having problems at all levels of care. So the 5th pillar we looked at was around the public health emergencies. How do we respond? And we've seen a lot of gaps and fragility during the COVID pandemic that has taught us a lot of lessons. We've seen the weakness in our health systems, but to God be the glory, we're able to cope with the situation as of that time, but it really revealed a lot of weaknesses within the health systems. And another area we also paid a lot of attention is a lot of more than 90% of importation of medicines, health commodities, medical equipment to Nigeria, despite the huge market that we have in the country. So we said, let's work on local production. How do we reverse that? Medical tourism were also issues around that time. And then partnership Partners, development partners have been in this country supporting the country for several years, or I would say hundreds of years. But it has not really yielded the desirable results in terms of sustainability and creating synergy. So partnership also with private sectors, partnership with communities, with civil society organizations. So we came up with these 4 thematic areas pre-election, and we proposed to the candidates, and then President Bola Ahmed, the candidate as of that time, he was a candidate. So he endorsed it and said this is exactly what he wants. And he said also we need to include health promotion, health education, so that Nigerians also will keep fit. But he's very much interested in all the areas that we identified. In fact, he emphasized also on the area of local production. So immediately after he won the election, when we came back, he set up what is called the Presidential Advisory Committee, on specific health sectors of development, not only health. And health happens to be one of the core areas that were selected, areas like economy, agri, women affairs, and so on. So health happens to be there, and each were put in a different subcommittees. So I was nominated to chair the Presidential Advisory Subcommittee on Health. So we started working around that area to refine the pillars, the agenda. And that was when we came with the word Renewed Hope Health Agenda of President Bola Ahmed Tinubu. So it was refined around that 8 pillars, and he endorsed it for implementation. So as ministers were appointed, we also create awareness. We engage with the Honorable Minister of Health and the Minister of State as of that time, and we handed over the document to him. And we said we are ready also to provide all necessary support to ensure implementation of the policy direction. So this was taken forward by the Honorable Minister. So that is just a little about the background.
All right, so all this was adopted by the administration, and which later set out to implement them. The general question that people would ask is Nigeria better health-wise than it was before this was put forward? Are Nigerians getting better health care, delivery services than they used to? It's a basic thing that we start from.
Yes, thank you for that. I will say yes, because I have been in the system prior to this administration, I think for a very long time, coming in and out at different levels. So I would say yes, it's still work in progress, because this is the first time we have an administration with an articulated agenda for implementation for the health sector. And immediately the team was put on board. They didn't waste time to start the implementation of it, and also bringing in innovations and approaches that will work best to achieve that implementation. So if you see around, I will look at it around the 8 pillars. If you look at the governance areas, one of the proposals we made and recommendation as of that time was that health is not a standalone. It's beyond health. There are several determinants of health. There are several factors that fuel illnesses, and most of them are outside the domain of health. So it's a whole society approach, and that was what led the president to rename the Ministry of Health as Ministry of Health and Social Welfare. So, and then to also appoint a coordinating minister of health. So the minister relates with all other relevant ministries, like agriculture. If you look at issues of nutrition, it cannot be handled alone by health. You look at other issues of gender responsiveness. We have to work with the Ministry of Women Affairs. A Ministry of Education plays a key part right from primary schools, the school health program, including school feeding education, including the infrastructure and the production of health professionals. If you look at across the spectrum of medical doctors, nurses, midwives, pharmacists, laboratories. So it's a whole society approach, and I felt this was achieved because we categorized the Renewed Hope agenda into 3. The short term, which the president did immediately within 100 days of coming into office, and that includes the appointment of the right person, renaming the Ministry of Health, the whole society approach to be used for that. And then the second part of it was 2 years, which we are currently reviewing. Then the last part of it, we are yet to come, 4 years by the grace of God. So 2 years down the line, if you look at it, a lot of achieved the human resources for health, if I may take that aspect, which is a global challenge, but Nigerians has made a lot of progress to ensure that we address the issues of human resource migration.
Exactly, because when you talk about that,
Yes.
and one of the things we would look at is what has generally come to be known as the Japa syndrome.
Exactly.
Health professionals exiting the country.
Exactly.
Has that reduced to any significant level?
It has reduced, one can say that, because of the measures that have been taken. Immediately the president came last year, he launched the workforce migration policy, which is aimed to address the issue of migration, specifically to attract those in diaspora to come back, and also to retain our own human resources. Definitely we can't retain 100%, but to have a balance in terms of the Nigerians that stay. So looking at their welfare, their incentives, their remuneration, and then the quality of training also, we need to increase the quantity. So this has been addressed. It's not fully addressed, but it's still work in progress, but a lot has been done. Currently, we have an agreement with the Ministry of Education through the TED Fund. They've released over 110 billion, if I'm quoting it correctly, to strengthen capacities of 18 tertiary institutions in Nigeria. And that is aimed to boost the production of healthcare professionals, doctors, nurses, midwives, and pharmacists in this country. So for instance, for doctors, if we are producing about 68,000 in a year, we've now increased it to over almost 100,000. Nurses has gone beyond 115,000. So this includes infrastructural upgrade, expansion, and then the training materials and all that. So this is currently ongoing, and we hope to see a result out of that. And then one of the most important things also that His Excellency the President did was to increase the age of retirement for health professionals across board. So they used to retire at 60, now it has been increased to 65. And the Office of the Head of Service of the Federation is currently working on it to operationalize. So all those will yield results in terms of human resources for health.
Right. Still under the matter of human resources and an improvement in the welfare of the health professionals, as many other issues that often lead to strikes within the healthcare system, sometimes running for weeks and months on end. And the bother around welfare, provision of equipment, and such matters. How has that been addressed?
So yes, so most of them, some of the reasons that they give is actually doing JAPA so that they can have a more conducive working environment and also have the right equipment. So what we have done in this administration in the last 2 years is to upgrade the tertiary institutions. You must have seen a lot of massive upgrade in terms of infrastructure, state-of-the-art medical equipment in our tertiary institutions currently, and it's still going on. If you take the example of oncology, which is cancer treatment, today we have about 18 tertiary institutions in Nigeria that are providing radio diagnosis for cancer and also radiotherapy for cancer. So these are progress, but these are only federal institutions that are directly under the responsibility of the federal government of Nigeria. There are more facilities in Nigeria, much more, that are under responsibilities of subnational government. And that we are doing a lot of advocacy to see that they also upgrade the secondary level of care and also the primary level of care. And what we did to get them to do that is to ensure there is an alignment, with the vision of the federal administration. So the president signed what we call the compact at the initial stage with all state governors of the federation, which means that they have fully aligned with the Renewed Hope Health agenda. So whatever is happening at the national level, they will also key into it and ensure that they operationalize at the subnational level. So when it comes to the secondary facilities, which are directly under the purview or responsibilities of our state governors, they are also putting more investment. And we are beginning to see a lot of states keying into that. And at the local government level, through the national primary healthcare agencies, we also have a limitation in terms of our responsibilities. And that is a huge platform that is expected to deliver services to more than 70% of Nigerians, because most of the elements are minimum basic. So we aim to provide basic medical care through the primary health care. And this support, which we call the catalytic funding through the basic healthcare funding, which comes from the 1% consolidated revenue, which is given to the primary health care and also the national health insurance to close the gaps in terms of healthcare delivery to vulnerable people at the community level. So yes, people are getting more services because, as I'm talking to you today, almost 13,000 primary healthcare facilities have been revamped, revitalized, and are functioning effectively. So overall, we said almost we've reached 21% in the media. And this is just federal government contributions. providing basic medical services. But we also expect the state governors at subnational levels to also key into it. And recently, with the creation of, strengthening and the revamping and the empowerment of the local government, we've been working closely with the ALGON to do a lot of advocacy, to do a lot of sensitization so that they understand what are their responsibilities at the local government level when it comes to health sector development and healthcare delivery. So their major responsibility is about having a functional primary healthcare facilities that provides the basic minimum services and also establishing a pathway of referral with a secondary level of care. At the same time, empowering communities, to be able to know what are their rights and also their responsibilities when it comes to, health awareness, health education, health promotion to prevent illnesses within community. So all this work are happening at the same time, and a lot has happened within the first 2 years, I can comfortably say, because from the statistics, from the data that are being generated from government at subnational level, and then from our performance reviews, we've just done a joint annual review led by the Minister of Health, we are beginning to see an increase in uptake of services. Because if you look at just visits to primary healthcare facilities today, it has improved from what we used to have on our record of 12 million in 2022. Today we have over almost 50 million people visiting primary healthcare facilities and uptaking services.
Okay, because you mentioned that, and somehow if you look at the statistics in the past, it showed that citizens were going to tertiary health institutions for relatively common ailments like malaria, going to a teaching hospital to treat malaria. And the primary health centers had just about gone comatose. So you say these have been revamped now.
Exactly. So this is what we want to reverse, because the tertiary institutions are not set up to provide services that should be available at the primary healthcare centers. They are set up as training institutions. They are set up to be able to conduct research. And thirdly, to deliver medical services that are highly complicated, referred to them. So they have no business into providing the basic medical services. Unfortunately, because those arms, the secondary level of care, are not functioning effectively, were almost non-existent at the primary health care. So you find a surge of our patients and clients coming to the tertiary institution for services. So this is exactly what we want to reverse. And this is what we've been doing in the last 2 years, making the primary health care to function, making the secondary level of care to function before referrals are made to the tertiary institution so that they can focus on specialized care. We don't need to go out abroad for specialized care. These services are available in Nigerians. Our medical doctors are well trained, because even if when you travel abroad, you will see a lot of Nigerian medical doctors providing services in developed countries, in the US, in UK, in Canada, Australia, and in Saudi Arabia. These are most of the countries where we travel to. So we want to reverse that, and that efforts have been ongoing, and we are beginning to see results, because a lot of reversal is happening. If I tell you, Cyril, you'll be surprised, because I saw hospital data in some hospitals in Nigeria. Visit Nizamiye Hospital, visit Nisa Hospital, Premier, visit Afrexim Hospital that has just been opened. You will see people coming from outside Nigeria to access services, because they are quality services. They are also much, much cheaper to access. And we are beginning to see reduction in Nigerians seeking services abroad.
Right, that brings us to the matter of providing the much needed equipment, even after the training, and then of course, the big one, the cost of health care. This has been one of the huge challenges. Yes, you had the hash of medical tourism, but that's for people on the upper echelons of society. At the grassroots, healthcare was a challenge, still is, because of affordability. Now, how has this policy addressed that?
So, we recognize ab initio that healthcare it's a challenge. It's a lot of hardship to a lot of Nigerian populace, because majority of Nigerians, over 70%, pay out of pocket. And it creates additional hardship and a lot of competition, even with food that families will eat. So it was based on that this administration, committed to increase the budgetary allocation for health. And the current administration has demonstrated that in the last 2 years. From less than about 4%, today we are at 5.18% federal allocation for health. In addition to that also, we've also increased the allocation of the basic healthcare funding. This has doubled in the last few months. So if we're given like about a facility receiving about 300,000 naira, for instance, per quarter, this has doubled to about 6, and this is just federal government. This administration, the president has also approved what we call the Vulnerable Group Fund. So these are all aimed to address what you have raised, people at the grassroots level. Even people within urban slums cannot afford healthcare services. So it is aimed to protect them, to reduce financial hardship, to reduce expenses and to bridge and close the gaps for them. So we are actually investing in health insurance coverage. And our information has shown, the data we generate in the last 2 years till today, it has shown an improvement from where we started. In 2012, the coverage was about 12 million Nigerians. Today, we have up to about 21 million Nigerians, which is still a short of it, but it's a huge progress that has been made. And this is just looking at the federal government allocation for basic healthcare funding. So what we have done, because the governors at subnational level have committed to align with the Renewed Hope Health agenda, so today, all the 36 states of the Federation, including the FCT, they have a state health insurance scheme, or what some call the State Health Contributory Scheme. And they are also making efforts to contribute to that level. So all these are happening to reduce cost. But in addition to that aspect, what very important aspect we've also done is bringing the other pillar, which I mentioned earlier, about the local to reduce cost. Unfortunately, Nigeria imports almost 90% of the drugs that we consume in this country. It used to be about 70%, then it went to 70%. But if you look at even the active pharmaceutical ingredients, the components that are used to produce drugs, we produce almost 90% in Nigeria or 100% in Nigeria. So with that, there is no way we can reduce the cost. So what we've done in this administration at the highest level, because the president is committed to it, he created the Presidential Unlocking Value Chain. This is a dedicated office led by an expert who has experience working in development work on how to unlock the potentials of medical services in Nigeria. So that office is well established. As I'm speaking to you now, a lot of work has been done in terms of how to reverse and ensure that local production in Nigeria. So at the presidential level, what he did by himself is to waive tax and value-added tax on importation. So everything that has to do with medical supplies, they are freely imported into the country to encourage, and also leverage the potentials in the country. So that has greatly improved the environment. We're working closely with the private sector, working closely with the Manufacturers Association in Nigeria to leverage, because those has been one of the major challenges that affect it. So, and then it also creates an enabling environment for investors to come into the country. As I'm speaking to you, the last count that the coordinator told me that he has signed an MOU, Memorandum of Understanding, with over 75 foreign companies that are willing to come and invest in Nigeria. And they have already unlocked over $2.1 billion in that aspect. So a lot of progress is going, and we are beginning to see reduction, because if the drugs are produced in Nigeria, if the equipments are also basic equipment, we saw during the COVID, we have to import even simple face masks, protective measures. So if all these are produced in Nigeria, it will drastically reduce. And today you have seen a lot of companies producing face masks, hand gloves, and several other things. And the cost has drastically reduced. And we hope to see much more happening, because it is still work in progress.
You did say that health is not a standalone. And manufacturing, local manufacturing, of course, would depend on a lot of factors, not the least energy.
Yeah.
And since realizing that you have to have an active collaboration with all other sectors that affect the provision of quality health, how are you engaging with those who should ensure that the power base, the energy production and development of the country is standard as to encourage manufacturing and also reduce the costs, because if you provide in your own power as a manufacturer,
Yeah.
the end result.
Yeah. So that's very interesting, and this is exactly what is happening. You know, as I said, it's beyond health. So for the local production, it's a lot of diversity and a lot of involvement of stakeholders and relevant ministries, authorities, and regulations. So if you look at the Ministry of Interior, it's one of the great partners, because a committee was set up, and then the Minister of Health, Minister of Finance, and then Interior are all there. So they've been able to move forward in terms of the importation, because they are working with the Ministry of Interior, the immigration services already, and then the other aspect of course, the power, the energy. The energy, it affects our hospitals.
Yeah, because
grossly,
you see, I'm raising this question because
Yes.
I recall that not too long ago,
Yes.
teaching hospitals in this country cried out because they were unable to,
Exactly.
foot the bill, the
Yes.
electricity bills, and that was seriously affecting
Affecting our
service.
healthcare delivery, because if they have to increase the cost of their services, Nigerians will not be able to afford. So with that, the Honorable Minister, the Ministries of Health went into partnership with the Ministry of Energy, Ministry of Power, and they've reached an advanced discussion in terms of how do they subsidize energy to the tertiary institutions, and also explore opportunities, alternative energy, not just limited to this. And we have had recently, I think a few months ago, that a workshop took place, and an advanced discussion has taken place in terms of reaching consensus on how best to address those issues. So this is ongoing with the federal institutions, but of course also even at the sub-national level, it also affects them. And we are also bringing on some national level to also benefit from such discussions and agreement that are going, because it is a must that we must subsidize energy if we want to achieve an effective and quality healthcare delivery within our facilities. We must explore alternative source of energy in our hospitals, where most of the facilities at the moment are currently using.
All right. At this point, we'll take a short break. When we return, there'll be more regarding the health and well-being of Nigerians. Thanks for staying with us. I'm still here with Dr. Salma Ibrahim Anas, Special Advisor to the President on Health. And it's all about the health and well-being of Nigerians. Dr. Salma Ibrahim Anas, we've talked about what the government has done in trying to turn around the fortunes in health. There's one big area which is still of serious concern, and again, the challenge here is further compounded by the fact that statistics are really difficult to come by, and that's talking about the maternal and child health care. Those have been very sore. If you look back, and the story is not it's not good to look at.
Yeah, thank you for raising that. It has been said that Nigeria has not made very significant progress over the time. So when we came, it was an area that was prioritized, because we just had our demographic health survey launch, for 2022-2023, and the indices are still not good, very, very poor, in terms of women dying from causes related to pregnancy, childbirth, and postpartum. The same thing also the death of children under 5 years. So what we have done, using the statistics, directly, we identified those hotspots that contributed the largest burden of maternal death in Nigeria. And we found them in 172 local governments across the country, mostly in 33 states of the Federation. So what we did was an aggressive action, more interventions that has proven to work, to be delivered in those local governments, so that we traject the acceleration of the reduction of maternal death. And there is a program that was recently called, what we call the MAMI project, which is an initiative that will fast-track the implementation. And it is aimed to target these 172 local governments and the primary healthcare facilities in this local government, upgrade them, strengthen them, provide human resources for health, ensure that all the commodities the life-saving communities that save the lives of mothers and the newborn. This is where also we remain stagnated, unfortunately, in the country, are available within those facilities. So comprehensive emergency care. So we are already doing that, addressing at different levels. Because one of the major causes are associated with the delays. Delays at home, so it involves community. Delays in decision to take a pregnant woman to a facility to deliver. In most cases, the women do not have the power to negotiate that. So what we did around that is to have more community participation and awareness creation to ensure male involvement in that decision making. Because decision has to be taken to transfer a woman to a facility. A lot of men will say that they have to get permission, and women will not even move to a facility. Then the second delay is about transportation, because a lot of them are living in rural communities where transportation are not available to transport them. So we provided the emergency ambulance systems in those communities. And we also partner with what do they call them? Nigerian Association of Transport Workers, so that they can also transport women. And this is happening in those 172 local governments, because you have to reduce the time for transportation. So we're addressing that issue through the emergency transport system. Then at the facility level, you find before most of our facilities were dilapidated, and then the services are not there, the human resources are not there. So those were targeted to upgrade the facilities, which is already ongoing, and a lot has been done in terms of the upgrade through the National Primary Healthcare Development Agencies, and also provision of the essential life-saving commodities. They are also available. And then the human resources for health, including laboratory and facilities to ensure availability of blood for transfusion. So with this, just within the last few years, less than 2 years, we are beginning to see an improvement in a reduction of maternal mortality, and also improvement in survival of newborns. In fact, in some of the statistics that I observed, I noticed that there's an improvement, almost like about 17% reduction in newborn deaths, and almost about 25 or above % in reduction of maternal deaths. So you can imagine if we scale this up and we have sub-national level also putting that effort in a sustainable manner. It's not something that you do one time off. Pregnancy, it's a continuous process of survival and generation of new generations in this country. So these are efforts ongoing under the MAMI. Then if you take the issue of children under 5 years, where we also contribute remarkably, we have also boosted our immunization activities, which is a key game changer, to improvement of survival of children under 5 years. Recently, we've introduced the rubella vaccines for children, and then the coverage has improved across the country from 35% to about 52% coverage. That is children that are uptaking all the recommended vaccinations, children under 5 years. So this is remarkable. We also introduced the human papilloma virus vaccine for children, for girls specifically, to reduce the scourge of cervical cancers. And in fact, it's amazing the coverage. Nigeria has reached almost 71% and above coverage of girls.
Those two had wanted to zero in on rubella and HPV, and seeing how under this administration you've been able to address those matters that usually lead to low coverage in terms of immunization and acceptance of these cultural factors. What sort of community engagement have you done on these? Yes,
so it's true. I think this is a success story that happened within a very short time. So what we did was engagement, because it has a lot of cultural undertones, the hesitancy for vaccine. And then people use a lot of misconceptions that don't even exist at all and continue to propagate it within communities. So what we did was to strengthen collaboration, partnership with the religious leaders and the community leaders, and continuous engagement in terms of enlightenment. In fact, some of them have been taken on study tour to different countries in the world, especially in Africa, that we share similar cultural issues, and they have seen the uptake is very high. I tell my friends and my relatives that are from northern part of Nigeria, when you go to Saudi Arabia, the first thing they drop the polio vaccine in your mouth, and you don't reject it. But then you come back to Nigeria and you say it's anti-religion. You don't want to take it, and you continue to. So most of them have no basis. So engaging with the religious leader has really transformed the landscape in terms of knowledge. The correct information, accurate information have been provided. And now we have religious leaders and community leaders as champions, propagating, educating their communities. And also, they are also being incentivized, they are also being appreciated for the work that they are doing. And I think that has been the game changer, especially, when we started the HPV vaccine for girls. It was a huge challenge in terms of misconception. But I'm glad to say that this has been addressed. And Nigeria, among African countries, has the highest today coverage, despite our population, of our HPV vaccines, in Africa. And we are also beginning to see increase in uptake of immunization coverage in the country. This is not only around immunization, it also has to do with family planning. Family planning is another game changer that reduces maternal death. So as we said, if a woman is not exposed to pregnancy, she has no business dying from pregnancy-related causes.
And these are very, in some parts, sensitive and deeply cultural factors that you have to take in when you speak of family, and religious as well.
Exactly. So it has been an area that it's very difficult because of the sensitivity, because of the misconception around it. But that is most important is about the health of the mother. The mother has to be healthy for her to have a baby and also take care of the baby. And this has been scientifically proved. So we use the science and evidence when we engage with our religious leaders, when we engage with our community leaders, let them understand the facts behind it. Because every pregnancy is a risk on its own. But every pregnancy that goes beyond 4 has the highest risk. So when you look at early pregnancies that happen at a very young age, and we term the young age, the body, premature, unmatured body, up to the age of 18. So the girl is still developing, so she's likely to burst even her uterus as a result of pregnancy. And that is where we have problems of fistula, leakage of either urine or both urine and feces. So that is one of the complications, and they have seen it in communities of girls that have been exposed to early pregnancy. So pregnancy that comes very early is a risk. Pregnancy that happens very late also is a risk. Then pregnancies that happen too frequently, less than 2 years, is a risk because the body has not finished replenishing. The uterus is just like a balloon, and it has not contracted back to its normal size and before it gets ready for another new pregnancy. So it's a huge risk also where the woman can have bleeding, eclampsia, hypertension in pregnancies, and subsequently death or other severe complications. Then pregnancies that happens too many, 4 categories. When you have too many pregnancies, more than 4 is a risk. So those are scientific evidence that back them up. And we share them with them, even within communities. So once they believe in it, they will now become the champions that propagate the new messages. And this is still work that is ongoing. And then family planning, as I said, whether we call it child spacing, or healthy timing and spacing of pregnancy, it's not a new thing.
How do you deal with matters surrounding family planning? For instance, the matter of contraception and the general belief that that could lead to promiscuity.
Not at all. It's a misconception. It's a misconception. So if you remember, we're not promoting promiscuity in the health sector, we're promoting health. So that's my responsibility. I mean, primarily is to save the lives of people and then also save the lives of women and children. So whether the woman is within any circumstances, I put it that way, my responsibility, our responsibility in the health sector is to see that we save lives. So we provide information, the correct information, the accurate information, and encourage people to use those information and uptake those services based on their own circumstances. So this is the work of a health worker, and as a health worker, this is what we've been doing. So this is also what we have in our policy direction of this administration. This is prioritized child spacing, healthy timing and spacing of pregnancy is one of the pillars. And this has started since 2012. the federal government of Nigeria has been contributing to the procurement of family planning commodities in Nigeria. And this has been on since that time, throughout the previous administration till this administration. We just signed in the last administration the 5 years renewal to continue to do that. And we are doing that. So, but still it's grossly inadequate. So what we are promoting today is that subnational government should also key into it. And I'm glad to mention that over 15 state governments today have a budget line for procurement of commodities for child spacing, as a critical component of their health sector delivery, just like they procure paracetamol and every other antibiotics. So this is progress that will improve not only survival of mothers and children, but the entire family and populations in Nigeria, that will improve productivity, that will also improve and leverage the potentials, especially of girls and women, to be more productive and contribute their own quota to the national development.
Earlier you spoke about research, and I noted that this is one area we would have to come back in. Research in addressing the production of medicines, research into ailments, and some would say there are still ailments we're battling with, and we're wondering why the health sector has not gone far in researching into those ailments and how to ameliorate them. Then that's on one hand. And the other side is speaking about lifestyle issues and health. Of course, the ministry was renamed Health and Social Welfare, and those fall under it. How do you address those matters under this agenda?
Yes, so let me start with the lifestyle changes. One of the key components of this administration among the pillars of the integrated healthcare delivery is health promotion, disease prevention. So it's key that we are working assiduously. We've reviewed all the policy guidelines around health promotion, because Nigerians need to take responsibilities for their health. Lack of knowledge is not an excuse, and we have also stepped up actions to ensure that we provide the information for all Nigerians, irrespective of where you live, because our vision is to see that we achieve universal healthcare coverage. And a lot could be averted with adoption of healthy lifestyle. Living healthy, avoiding the wrong food, smoking, excessive consumption of alcohol, exercising, and all that. So we are working to promote that, and there's a section in the Ministry of Health in the NCDC, the Center for Disease Control, the National Primary Health Care, that are all assiduously working. And all these structures are also replicated at the subnational level, up to the local government level, to create awareness so that people adopt healthy lifestyle and live a healthy life, so that they can prevent infections or ill health. And then the first point of call, if we have a functional primary health care, that anybody can walk in routinely and then, for instance, test your blood sugar for diabetes. You may not even have diabetes, because it will be detected at a very early stage. And then measure your blood pressure. It will be detected at a very early age. And that can easily be managed before it becomes complicated to affect your heart, that will warrant you visiting a tertiary institutions. So we are making now the connections and the dots, addressing it from the grassroots level. So that aspect is going on, and there's a robust plan and a robust effort going on. So that takes us to the issue of research. Research has been very weak in our systems, because most of our research in the past were donor-driven. If they have interest in an area, they come, they conduct the research. So what we have done in this environment, in this administration, is to strengthen capacities for research within our tertiary health institutions. As I mentioned earlier, the health institution, one of their major responsibility or mandate is to conduct research. And they've not been able to be doing that effectively, because they are so overburdened with access to services and delivery of simple, uncomplicated services, and like malaria, as we said,
yes. And now
which
the
they should not be
international
doing.
donors are pulling back in support.
Exactly.
Right.
So if you say you've delivered 200 women normal deliveries at a tertiary institution, it's not impressive. We want to hear, how much research have you done that will change the landscape? What innovations have you brought on board in terms of our health sector development? So this is the direction of what we are doing. But of course, we have also set up regulatory systems in place. We have today we've had the ethical committee, which has not been functioning effectively. This has been revamped, an ethical research committee in the Ministry of Health that ensures that every research work has to pass through and meet the criteria through the ethical research committee. So this system has been strengthened and is well established. And you remember we have other tertiary institutions like the NIPRIT, which recently also did a lot of research, and they've also started producing a lot of things. They did produce a lot of sanitizers during the time of COVID and several other things. Then the NIMA, the institutions also, they are now currently well positioned to do research. So I mean the capacities are currently coming up in terms of conducting research in Nigeria that we can call our own ownership, homegrown researches that will address our own issues in country.
Speaking of our own, this is one aspect we must look at before we round off, and that has to do with alternative medicine, integration, or what we know as traditional medicine. Other countries have used what they have to produce, and we have sometimes gone for those. But Nigeria is rich in so much, and we're wondering how far with integrating that aspect of medicine. This is our own.
So this is our own. Though I'm not a traditional medical doctor, I'm a medical doctor, scientifically trained.
But now you are in the position of policy.
But we recognize that, the wisdom, the talents, and then the capabilities within that sector. And if you see today, within the Ministry of Health, we have a whole department dedicated to alternative medicine. And also there is an institution of alternative. Recently, one of our own Nigerian was made, I think, a DG of one of the institute by WHO. So that is to show that Nigeria has given them the platform and the enabling environment for them to operate. But of course, what we keep on saying, there must be regulation. There must be openness and transparency. For instance, you cannot just say, just pluck that leaf and take it without a dosage. There must be scientifically proven that what will be the effect, even if you take paracetamol, there are side effects which are clearly indicated. There are dosages, and then what organ in your system it will affect. So these are the level of transparency we are still trying to see with our traditional and alternative medicine experts in this country. But of course, the environment is open for them to excel.
Right, but seeing that a huge chunk of the population, especially at the grassroots, still rely on local herbalists, people who have knowledge about combination of certain natural ingredients to provide relief, what is the thinking of the government towards integration? Yes, you need openness, you need regulation.
We need regulation.
But how much are you engaging? In the past, there was some amount of engagement to try and find a middle path and develop them. Is this administration thinking of going beyond that and really looking into how to open up, get more revelations, get them to be more comfortable with scientific research?
Definitely. This administration is 100% open. As I said, we've given them that platform. Institutions are strengthened. They are on government budget as well and support. There is a full-fledged department in the Federal Ministry of Health that really has given them the opportunity to do research and then be open. But when we engage with our patients and clients, we educate them. They must have, a complete information in terms of what works, what is the dosage, what does it affect, what are the side effects. So that is still not forthcoming, but it's still work in progress. So I cannot just refer somebody to say, just go and take a herbal medicine without knowing exactly what are the dosages. And I'm glad to mention those that have done it locally in Nigeria, they have been registered by NAFDAC. There are those that produce the garlic, the moringa and all that. And they have been registered because they have really quantified in terms of the quantity that the body can tolerate. And this has been scientifically proven. So those are the kind of things we want to see, and they will make progress in that. But it's still work in progress.
Right.
Not much has been achieved there.
Right.
So I still advise Nigerians, please, access services at the nearest primary health care facilities within your reach. You know, go there even when you are not sick. You can have access to information to remain healthy.
We're about rounded off now. And so in just a few words, preventive medicine. You started talking about it, enlightenment, education, access to information. So you'd avoid the need, even, of rushing to a health institution by so many things. Simple steps were taken, preventive matters. And you talked about lifestyle changes. That's what I'd like you to conclude on this conversation.
Yes, I think that the first weapon, as it is already said, everybody is a non-fact and saying that prevention is the best. You know, is the best. The spectrum of health, when we talk about health, is not only for sick people. Health starts when you are healthy. You're not even thinking of any sickness. And that's where we look at the spectrum of healthcare delivery. It starts from health promotion. You're just thinking of being healthy, and then prevention of the disease component itself. So you just wake up, you want to be healthy. What food am I eating? Do I need to exercise myself? Do I need to be in a smoky environment? Do I need to smoke? Because even secondary smoke affects people and individuals. We are beginning to see more of cancers, especially lung cancers. And then do you need to take excessive action? So all those lifestyle changes and adoption are very significant. Then, of course, disease prevention, hand washing before you eat. You must clean your hands. Spraying of foods on the streets, whereby rats will come and run over them and excrete on them. This is common. We need to educate people around it. And then we end up having Lassa fever and other infections. It's so rampant across the country, and the major source of it are rats that pass across food that we sprayed. We eat our amalas that are sprayed on the roadside, our miyan kuka that are sprayed on the roadsides, and then people are ignorant. So we need to educate. When you sell food, food sellers, you have to be hygienic. You have to cover your food, you know, protect it from all contaminations and all flies. So we continue to educate people on personal hygiene, on environmental hygiene, and also on pollution.
Okay. I say all the time that no one program can cover all the areas. Yeah. So we'd like to say we hope we can ask you to come again and explore further this matter of the renewed Hope Health agenda. Okay. But for now, Dr. Salma Ibrahim Anas, Special Advisor to the President on Health, we'd like to thank you for coming on One-on-One.
Thank you so much.
Thank you. It's been an interesting time with you. Thank you.
Thank you so much.
Right. And that's our program today. We thank you for watching. Next week we'll be back with One-on-One. I'm Cyril Stover.